Welcome, everybody. Welcome to another episode of PEM Rules, the Pediatric Emergency Medicine Podcast. I'm your host, Yaron Ivan, as usual. And today I'd like to talk about a very important topic that we, as emergency physicians and clinicians, have been hearing much about. The topic of today is physician wellness. And what struck me over the last 2 or 3 years when I hear about this topic is I often hear about it from non clinicians. So, we clinicians get a lot of advice from several sources about how to take care of ourselves and how to engage in well being, etc. And I always find it odd that we don't hear about it from other physicians. So, today I wanted to talk to a physician who I think does a great job in taking care of himself. That person is Dr. Jake Snow from Las Vegas. So, welcome, Jake, to the show. I know what you do for a living and I know how busy you are, so I appreciate you coming on the show. Let me just introduce you to the listeners. And please correct me if I'm wrong at any time. Stop me at any time if I said something incorrect. Jake is
Sure.
originally from Salt Lake City, Utah. He went to undergraduate degree. He got his undergraduate degree at the University of Utah and medical school in the University of Toledo, followed by general pediatric residency, just like me, and fellowship at Nationwide Children's Hospital in Columbus, Ohio. Is that right?
That's correct.
That's correct. And the topic of today is physician wellness. And the reason I wanted to have Jake is because to me, Jake is the ultimate role model for physician wellness. So not only he is the assistant director in Las Vegas, and not only works clinically, he has not one, but not two, not three, not four, but five kids. He's very active in his community. He coaches soccer, he coaches basketball, and somehow, with all that, he takes a considerable amount of time to be engaged in things that I know he loves, like hiking and climbing and all that stuff. So I thought it would be perfect to discuss physician wellness with a physician that I think does a great job taking care of himself. So welcome, Jake, to the show. How are you?
I'm doing well. Thank you. I appreciate the opportunity to be here.
Oh, perfect. I think our listeners can learn a lot from today's discussion. My first question to you, Jake, and if you listen, and I know you've listened to PEM Rules in the past, is a question I ask all my guests on PEM Rules, and I'd love to know your answer. What is your definition of a good PEM physician? One who does what?
I would say there's not really a short answer for that one, but to make it somewhat succinct, a great PEM physician is one who recognizes and can confidently navigate all the different facets of a child's emergency. So when a child shows up to the emergency department, some of them will have a medical emergency that needs to be addressed, and a great PEM physician should be able to confidently address that medical need. Others will not actually have a medical emergency. They may simply have a perceived emergency that the parents are experiencing differently than we do. Some of that's related to their social situation. Some of it might be related to psychological situation. And a great PEM physician needs to be able to recognize and treat appropriately patients who present without a medical emergency, but who are in your unit because of some perceived emergency. And those situations, while they may not require much medical complexity, often require the PEM physician to be a skilled teacher, to be empathetic to the parent situation, and to be able to help the parent understand the reason why I'm not worried about your child's situation. It's one thing for me to look at a chart and say, no, I'm not worried, that kid's going to be fine. It's another thing for me to help the parent understand why I'm not worried in a way that they leave feeling better about themselves and their child and more confident for the way they can care for them.
I couldn't agree more. And, it's really why I tell the residents in the pediatric emergency department, by all means, most of what we do are not emergencies. And we do a lot of patient and parent education. I agree with you. Sometimes easier said than done. And I like your answer because I think it's the first time on PEM Rules that the guest is giving an answer that is really comprehensive and not just related to the medical aspect of being a good pen physician. I can't help thinking that a lot of your point of view is having been here in Las Vegas for so many years. What do you think about that?
Well, it certainly does. In Las Vegas, we practice in an environment where we are very much underserved. Most of our patients do not have easy access, if any access, to primary care. And many of the primary care offices are stretched well beyond capacity, really unable to care for their patients in the way that's best in many instances. So we do see a lot of primary care type visits, and knowing how to deconstruct those in a way that helps the parent understand is essential. One of my mentors at Nationwide Children's during fellowship referred to those patients as absolutely essential to our experience in the ED, because it's easy to complain about them. It's easy to say, why is this person even here? It's not an emergency. And it's very easy to blame them and kind of take it out on them for being there. And to an extent, it's okay to do that as catharsis in the back room, among your colleagues. But when you're interacting with the patient and the parent, I think it's absolutely essential to respectfully and politely and skillfully help them understand that what they're worried about, yes, maybe something abnormal, but it's not to the point where they need any further emergency care. And it's okay and it's safe to take that child home and trust that the child's going to be okay. And that's much harder said than done.
Yeah, no, I couldn't agree more. And I do, goes back to two of my PEM rules that I discussed. Number one, complaining is like vomiting. It makes you feel a little better. It makes everybody around you feel a lot worse. As physicians, leaders, we really should not complain. And number two, and again, that's something that I usually discuss with the family medicine residents and maybe the pediatric residents. Many times, the sicker the kid, the easier it is, because I think for all of us PEM clinicians, running a code is in a way much easier than trying to convince a very worried mom that the fever is not going to cause brain damage. I find that oftentimes very, very challenging.
Correct. Yeah, I would agree.
So yeah, no, great topic and great answer. My next question to you, and that is exactly why I wanted to bring you to the show, Jake, is, we hear in the last, I want to say 3 or 4 years, especially since COVID, a lot about physician wellness. And I think mostly even more so in emergency medicine. And a lot of times I hear about physician wellness from non-physicians, from therapists, from administrators. And I always found it very interesting. Every once in a while, I come across someone like you who I think does a great job in taking care of himself. So engaged in hobbies, and I'd love for you to tell us what else you do. My question to you is, what is your biggest advice for us physicians in doing a better job taking care of ourselves, and what does it mean to you to take care of yourself?
Well, first of all, I'll just say I appreciate that you see that in me. I certainly wouldn't jump to identify myself as one who's an expert in physician wellness by any stretch, but I am one who I do deliberately focus areas of interest elsewhere outside of the hospital. And I think part of that is, because I need to in order to, satisfy the role I have as a dad and a husband, but also, frankly, sometimes medicine gets too heavy or routine, and you have to have something to break up that routine. And another one of my good friends and colleagues from Nationwide, she said kind of in a tongue-in-cheek way back when we were in training together, that emergency medicine is for people who want to practice medicine but don't actually want to be doctors. And what she was referring to with that is that, in emergency medicine, we do enjoy the medicine. We enjoy the patient care. We enjoy those interactions that we have. We enjoy the science of medicine. But at the same time, we don't want to be spending all day, every day doing patient care. Those of us who gravitate towards PZM oftentimes have many other interests, and we want to live a schedule and a life that allows us to explore those other interests. So all the way back to residency and fellowship and during med school, I've had other areas of interest and I've explored lots of different things. The kind of center of all of that has been my family. I was married during medical school, and we had 2 children by the end of 4th year of medical school. So family has been an essential kind of hub to my career from the very, very beginning. And being an involved and present husband and father has been something I've always tried to do. And certainly different phases of medical education have made that harder. Now that I'm an attending in a well-staffed group, I am able to balance that better and explore those essential family interests while maintaining the work as it needs to be done.
And what would be your advice for other people who want to do the same but are struggling with that?
Well, I would say keep in mind that there's different phases for everything. So when I was in fellowship and I was on my trauma rotation, there's no chance that I could have considered myself to be a present and engaged father because I wasn't present and I was exhausted the entire month. On the other hand, where I trained at the time, we had dedicated research months where we would have very little clinical care, and it would be, daytime hours research rotation. And during those rotations, it was very easy to be present and engaged. And so, bear in mind, depending on your level of training and where exactly you are in your course, things change and things can get better. And as long as you internally focus on whatever your interest is, whether it's family or whether it's a hobby or whether it's any number of different things, whatever your outlet is, bear in mind there will be seasons where it's harder and other seasons where it's easier to balance that out. So again, now that I'm in an attending position, as you mentioned earlier, I have 5 kids. I coach one of their soccer teams. I coach a basketball team. I help out with the school. I have kids in 3 different schools now: elementary, middle school, and high school. And so I'm involved kind of helping support the kids in their interests in all of those areas. And now with my schedule, what it is, obviously it's much easier than during my training years.
Yeah, absolutely. Great, great advice. I got to say, as I listen to you, I can relate to some of the things you said. I also had kids during my undergrad and med school. It was very challenging, but I like what you said. Basically, what I'm hearing is, as physicians, with regards to taking care of yourselves and taking care of your family, give yourself a break and be considerate of yourself. Sometimes it's going to be more than others, and that's okay.
Yeah. And I will say one of the challenges I've had with the physician wellness concept is sometimes with what we do, it is really, really hard to leave work at work. And I would say with emergency medicine, maybe that's easier than some fields, right? We don't have on-call hours so much. We don't get interrupted in the middle of the night on a regular basis to, come in and take care of X, Y, or Z. But we do see traumatic things regularly. We do see distressing things. We do have really emotionally difficult situations, and it can be very easy to bring those things home with us if we don't know how or have a mechanism for an outlet for those. And I can remember a couple of occasions where I have felt truly kind of trapped and down because I didn't know how to get rid of some of those burdens that I was carrying from cases I had been involved in. And there was one night in particular where before I came home, I simply could not come home to my family without getting, something traumatic that I had just experienced in the hospital. I needed to get that out. And I called a colleague, again, a colleague back in Columbus, on the phone, and I was talking to her and just saying, listen, I'm on my way home. I just experienced XYZ. It was one of the worst XYZs I've ever seen. And I need to talk about this before I go home because I can't take this with me home. And, we all need an outlet for those conversations. At different times, I've also talked to professional therapists because, again, knowing how to get some of that out knowing how to offload some of that burden that we carry is a skill that not everyone knows inherently. We have to learn that. And skilled and professional therapists can help you with that. Obviously, for many people, talking to a spouse can be helpful. Sometimes talking to your spouse might not be adequate, though. Sometimes you need to talk to somebody who can relate. So, you call a fellow trainee, you call an attending, you call someone you've worked with, because we can all relate. And so I've done all of those things, and that's been helpful.
Yeah, no, I couldn't agree more. I think it's the concept of trapped emotions that maybe you're talking about. You got to get it out. Again, easier said than done. I think talking to a colleague or a fellow physician is often very helpful. Talking to a therapist can be very helpful. I think there's still some kind of stigma or shame around it, which I hope will kind of phase out with time. But I appreciate everything you said. One more thing I wanted to discuss with you, Jake, and that has to do with one of your roles in the pediatric emergency department here in Vegas. Is you have the very, very difficult job, I think, very difficult job of doing the schedule for the physicians. And there are many physicians and a lot of needs and a lot of requests and a lot of families and kids. And you've been doing it for quite a while. I can say, as somebody who's been part of it, that you do a very good job, and it seems to be very thoughtful and very considerate and very creative and dynamic, which I love. So I'd like to hear your advice for those physicians out there who also do the schedules for the group. How do you do such a how do you take all those things into consideration and try to be the best schedule you can and satisfy so many needs by so many physicians?
So once again, I've got to thank my mentors back at Nationwide Children's Hospital in Columbus, because that's I guess, art of scheduling is something that I picked up and learned while there. So our section chief, when I was in training, would do the schedule for the entire department. And that's not something that every section chief of a major institution is going to do. They have many other very important things. And so it's easy for them to kind of offload that to somebody else, maybe even someone non-clinical. But at the time, her take on things was, I want to be the one making the schedule, so that if anyone has an issue with it, they come to me and not somebody else. And B, I know what it's like to work day shifts. I know what it's like to work night shifts. I know what it's like to have to flip from one to the other. I know what it's like to do the weekends and the holidays. And so I can relate better. And that's kind of the approach that, as I remember things, that's the approach she took in making the schedule way back then. And being a clinician and being a clinical leader, I try to make everybody's schedule make sense the way it would make sense for me. I don't want someone to have a schedule that doesn't make any sense, where they're flipping back and forth from days to nights and all sorts of awkward arrangements, because that's not what I would want to do. And so I try to be very attentive to that. There's a lot of different personalities in scheduling, and it would be untrue to say that over the years I haven't had misunderstandings or complaints that needed to be dealt with in all directions, right? So there's been times where I've had to talk to a colleague and say, listen, your requests are not feasible. The way you're requesting your schedule to look is not feasible. It can't happen. Let me show you why. Because if you request, such and such a schedule, what that ends up doing is it forces all of your colleagues into, the other end of that schedule. And I've had to have some of those difficult conversations to help kind of come to terms with people. But more than anything, it's just been trying to make a schedule for each of my colleagues that I would be okay working myself. That's kind of been the heart of it.
Very good. No, I think those are very, very important points. I can totally see what you're saying. And I hear you saying two things. Number one, I don't know if you noticed, Jake, but you keep going back to Nationwide, which goes back to what I always think about: where you did fellowship goes with you forever. So clearly,
Yes.
when we went with you for a very long time, and I had the same experience with my fellowship in Pittsburgh. And I'm trying to recall the phrase in English, but something about do to others what you would like be done to you. So you as a physician, you as a person, you as a father and a husband has certain needs with regards to schedule. You try to provide those needs to other people. I agree with that, and I think there's certainly a value to having the scheduler be a physician within the group. You agree with that? I think, right?
Yeah, I agree. At least at a minimum, the physician or a physician leader needs to be involved. Perhaps you offload that to somebody else if you have a big department and whatnot. But the physician leader needs to actually review and know and understand the schedule, because and a lot of the programs that people use have these auto scheduling options, and I've experimented with some of those, and the schedules that the AI comes up with is not great, and it wouldn't be satisfactory to me. And so in a similar fashion, if you're going to offload your scheduling to an AI program or to a secretary or somebody else who's helping, there's nothing wrong with that, but you still should go back and own that schedule, because ultimately, as the physician leader, you need to be the one owning that and be the point person to help accommodate requests and make the overall department work in a way that keeps people safe, keeps people happy, keeps people in your group, so that you don't have to replace them every 6 months.
Yeah, couldn't agree more. There's something about the human touch that the AI has not figured out yet.
Yeah,
I guess. Jake, thank you so much for coming on the show and sharing those pearls and that wisdom. I really, really appreciate it. I know you know the PEM rule tradition. You get to choose the outro. And again, very easy. You grew up in the 90s. So I know the kind of music you like, and it's easy to find. But I guess you wanted to hear something by Aerosmith. You like the song Walk This Way, which I already did in episode 35. You can check that out.
okay.
Your second choice was Dream On by Aerosmith.
Let's do it.
All right. So I'm going to have to learn Dream On by Aerosmith. I know the song. I think it's doable. So should be okay. Thanks again for coming on the show, Jake. Really, really appreciate your time.
Thank you.
And that is it for today, guys. Thank you very much for listening. And thank you, Jake, for coming on the show and talking to us about this very important topic. We all have to take care of patients, but you got to take care of yourself before you take care of others. That's actually one of my rules. So thank you for your advice. Thank you for choosing a great song by a great band. I hope you like it. Please continue to check the website, write back to me if there's any topic you want to hear about, and you can check out my articles on EP Monthly. This is Aerosmith, Dream On.